Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. Thank you for viewing today's episode of Dr. Ozello Sports Medicine Report. On today's episode of Dr. Ozello Sports Medicine Report, I am going to cover the pendulum exercise. The pendulum exercise is an exercise for the shoulder. It is a rehab and recovery exercise for any injuries where there is a limited amount of shoulder motion. The pendulum exercise is an exercise that's often done incorrectly. So we need to make sure that you are doing this exercise correctly to get the maximum amount of benefit. Now, this video does not replace you seeing a medical professional. This is the disclaimer part of the video. Again, this video does not take the place of you visiting a medical professional. Please do yourself a big favor. Make an appointment and visit a medical professional. Get a medical evaluation. Get a diagnosis, because that is going to help you on your path to recovery. Please do yourself a big favor. When you are doing any type of exercise, use proper technique. When you are doing any type of exercise, start at your current fitness level. Do not start at what you were before you started to feel pain or symptoms or had your injury. Please start at your current fitness level. Increase your intensity very gradually. Very, very gradual increments is the best way to increase the intensity of any type of exercise routine or exercise program. The pendulum exercise is going to help to increase the range of motion in the glenohumeral joint. The glenohumeral joint is the part of the shoulder where the upper arm, which is known as the humerus, attaches to the scapula. The scapula is the medical terminology for the shoulder blade. In the scapula area where the humerus articulates with it, it is called the glenoid cavity or the glenoid fossa. So that's where the term glenohumeral joint comes from. So when I speak of the glenohumeral joint, it is the part of the shoulder where the upper arm attaches to the shoulder blade. The glenohumeral joint, there can be conditions that decrease the range of motion in that joint. This exercise, the pendulum exercise, is going to help to increase range of motion in that area. This is a very good starting exercise if you have a condition called adhesive capsulitis. Adhesive capsulitis is the medical name for a condition that's often nicknamed frozen shoulder. When you're starting a rehab program, always check with the medical professional to make sure that this is the correct exercise to be doing. If you have an injury where there is too much motion in the shoulder joint, or there is laxity of the ligaments, if you have a shoulder dislocation, or if you have a separation of the AC joint, that is the nickname for the acromioclavicular joint, then this is not an exercise you want to do. Again, warning, if you have an increased amount of motion, or if you have a dislocation or a separation, then you do not want to perform the pendulum exercise. Ask your medical professional what would be a good exercise for you. Again, the pendulum exercise is often done incorrectly, so I'm going to go ahead and demonstrate that, and I'm going to explain it while I'm demonstrating so you see exactly how to perform the pendulum exercise. When performing the pendulum exercise, you want to make sure that you support your non-working arm on some type of sturdy surface. Like right now, I'm using a chiropractic table. You can use a workout bench, you can use a table at home, anything that gives you the support that you're going to need. Now, in this exercise, this is a passive exercise. It's not an active exercise. We use our body's momentum to move the shoulder. The first position is moving the arm up and down. Now, to do this one correctly, like I said, you have to have your hands supported. You want to hinge at the hips. We're not bending forward at the waist. We're not bending our neck down. We're keeping our spine straight and our neck in line with the spine. We're bending at the hips, like I like to call it hinging at the hips, and we're letting the arm hang straight down. Now, in this position, the shoulder is already in slight flexion. Shoulder flexion is this motion right here. when we are hinged at the hips and the arm is hanging straight down, the shoulder's already in slight flexion. Now the first motion is moving forward and backwards. So we're going to start with the hip motion, build momentum, and that is going to move our shoulder. As you can see, I'm moving the hips, and that is causing my shoulder to move. So the momentum from my hip motion is causing the shoulder motion. Like I said, it is a passive motion. It's not an active motion where I'm moving the shoulder. It is a passive motion where the momentum from my hip motion is moving the shoulder. So we always want to work through a pain-free range of motion. When you begin this exercise, the motion is going to be smaller, and then as you continue to do it, the range that you could go is going to increase. You want to go forward and back, and then we're going to go side to side. So we use the hip motion to build up the momentum and get the shoulder moving. We just finished front to back. Now we're doing the same type of stance and the same type of hip motion to cause the shoulder to move side to side. And then we are going to go in a circular motion. You can go clockwise and counterclockwise. So I'm going to go clockwise first. And you can see the hip motion, and you can see the shoulder motion. This is an excellent starting exercise for any exercise where there is limited pain-free range of motion in the glenohumeral joint, conditions such as adhesive capsulitis. Then once you have finished the required number of repetitions going clockwise, then you can go counterclockwise. And I'm going to say it again, the hip motion causes the shoulder motion. So this is a passive exercise. The hips are moving, and that momentum from the hip motion is what's moving the shoulder. The pendulum exercise can be performed every day. If you feel like you need to take a day off, then go ahead, because you have to listen to your body's signals. Again, the pendulum exercise is a passive exercise. Use the motion from your hips to move the shoulder to help to increase shoulder range of motion. Again, please see a medical professional before performing this exercise to make sure it is the correct exercise for your diagnosis. Also, start at your current fitness level. If an exercise doesn't feel right, including the pendulum exercise, then go ahead and skip it and find something that does. Always work through a pain-free range of motion. Again, the pendulum exercise is often done incorrectly, so watch the video, study the technique, practice the technique, and you will get great benefit from this exercise if it is the correct exercise for you. Thank you for viewing today's episode of Dr. Ozello's Sports Medicine Report. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. Please feel free to visit my website, championshipchiropractic.com, where you can get additional information on the book, and you could also connect with me on other social media platforms. Thank you very much for viewing today's episode. Please feel free to like this video. Please feel free to leave any questions, feedback, or suggestions in the comment section below. Also, you could subscribe to my YouTube page, Dr. Donald A. Ozello, DC. And I want to thank you again for viewing today's episode. And always remember, train hard, train smart, utilize nutritional strategies that work for you, stay injury-free, and accomplish your